Hello, good day. This is your number one health radio station, Pinnacle Health Radio. We are live on Health Masters this morning. We'd like to introduce our guest this morning. We are with Tope Alaure. Awala, yeah, from St. Cyril Cancer Foundation. Good morning, welcome.
Good morning.
Yeah, February the 4th is a very special day in the world because it's World Cancer Day, and in this part of the country it's very, people are really not aware of what cancer is, and it's very sad to this very day that we as a growing nation, a very large number of people in this country do not know what cancer is. Please, can you please elaborate on what cancer is?
Basically, cancer means when you have abnormal cells, abnormal growth of cells. It can actually occur in any organ of the body. You have an unregulated growth. Normally, cells grow, cells multiply in the body, but then we have regulatory mechanisms. But when cells decide to just grow on their own with no regulation, you have them result in cancer. That's a tumor, a growth.
Okay, a tumor or a growth. What are the type of cancer we have that are are there cancers that are very dangerous? Are there cancers that are not dangerous?
Yes, cancers can be, you can have a benign tumor, you can have a malignant tumor.
Wow, that's very big language. Can you break it down for us?
Okay, benign tumor basically means the swelling or the growth doesn't really pose much of a health problem to the individual.
That's benign.
Yes.
Okay.
Yeah, but for malignant, it means these cells progressively worsen, and by progressively worsening, they can actually lead to death. So, for benign growth, we're not so concerned. We can just have it out. We can take the tumor out, and they don't pose any any dangerous health effects. But once it's malignant, you need to intervene.
Or at no point in time will a malignant cancer grow and metamorphose into a benign, right?
Yeah.
Grow into it. Can it happen like that?
Yes, a benign tumor. That's why once you have any abnormal growth, you want to get it checked.
Okay.
Because you can never be sure if it's benign or malignant. You will need a medical attention.
Okay. Because
some of these cells can undergo transformation over a long period of time and then become malignant. So
I read online, particularly on Twitter, that there is a growth in cancer in Nigeria. Why do you think that is that rampant everywhere, cancer in Nigeria?
Okay, you're talking about the prevalence, right?
Yes.
Yes, I think it's because of the level of awareness. There are several factors actually. The level of awareness is involved. People are not that enlightened to know that yes, there are several cancers. The level of awareness. Also, the health-seeking behavior of our people. You can't compare it to the Western countries where just any slight abnormality, they go to their doctor and they're like, oh, I found a swelling, I found something. But for this part of the world, Africa, our people, Nigeria, you understand, people trivialize issues. And even when they think, okay, it's beginning it's getting worrisome, the first place they'll probably go to is a church or tell a friend or go to a traditional home. And then at the end of the day, before they get to the healthcare center, which is supposed to be the first place of visit, at the end of the day, the cancer is already like full blown.
So we always get there too late.
Yes, that's a major problem here. People report very late. I don't know. I think, like I said, there are several factors. I think people are afraid. and then out of pocket, people feel like, oh God, if I go to the hospital, I'll be charged, and you know.
So you think the Nigerian health sector has a fault in causing this, because they make the health sector not accessible enough?
Yes. I mean, well, we talk about people having to pay out of pocket for medical treatments.
Okay.
How much is the minimum wage? Okay. And then you have to go to a hospital. Well, it's not. I don't think the government is doing enough. I think.
So, in the treatment for cancer these days, do we have any new treatment that is less? Because I've heard chemotherapy, but it is really painful. People lose their hair, they lose weight, they lose appetite. Is there any new treatment for cancer these days?
Okay. No. I think there are misconceptions about chemotherapy.
Okay, please break it down.
Chemotherapy involves the use of drugs, to kill cancer cells. Now, newer drugs are being developed every day. I mean, we're having newer drugs with lesser side effects. Yes, there are side effects, and I think that any drug has side effects, but then chemotherapy drugs are powerful drugs. As you know, the cancer cells are stubborn, so you need something powerful to actually kill them. So for the cancer drugs to work, somehow they get to also affect the normal cells of the body, and then that's why you have a loss of hair, and some other side effects like skin changes and all of that. Yeah, but then at the end of the day, I think it has to do with benefits, risk weighing, that balance. You're looking at it, what does the person stand to lose and what does the person stand to gain? You understand? Newer drugs, there are other options aside chemotherapy, but then the treatment option actually depends on the type of cancer itself. There are some where just surgery, you can just take out the whole of the cancer cells, and then you're like, okay, you just need to monitor the person. But then in most cases, like I said, people present here late, and then the cancer cells have already spread to other sides of the body. Doing surgery, well, it might be helpful, but then you can't get so much benefit from it. Exactly. Other organs, other parts of the body are already affected, and then chemotherapy drugs they are like systemic. You understand?
Yeah.
Exactly. So you can be sure that every part of the body gets these drugs, and then they're able to. Yeah, we also have hormonal therapy, but then where you use hormonal drugs to.
Can you please break it down when you say hormonal drugs?
Okay, hormonal therapy. Well, take for example a person with breast cancer. Okay. There are some tests that will actually be done on the cancer cells to see how sensitive or resistant they are to some particular agents. So for some breast cancers, they could, after doing a test that's immunohistochemistry, where they actually check the cells if they have receptors for estrogen, which is an hormone, progesterone. Now, if such cancer cells show positive, then we know that for such patients, you can actually give these hormonal drugs, hormone receptor blockers, and hormone modulators to actually reduce the risk of the cancer cells from growing, and from spreading. Yeah.
Okay. Today is the 4th of February, which is World Cancer Day. It is mainly for cancer awareness. What do you have to say from St. Cyril Foundation? Because that's what you do. Can you please break it down on what you guys do and how you help beat this very terrible disease?
All right. Yeah, today is World Cancer Day. We are creating awareness. We are encouraging the survivors out there. We are, trying to enlighten the general public, basically. Now, okay, before I get to what St. Cyril Cancer Treatment Foundation represents, I'd like to say that we don't have a functional, a cancer registry where we actually have data telling us the prevalence of certain types of cancer in Nigeria specifically.
Okay.
So we are mostly working with data from other parts of the world. I think it's underestimated here. I mean, having to work at St. Cyril Cancer Treatment Foundation, I gotten to realize that there are actually many people who are fighting cancer, but then even their close relatives don't know because of, I don't know, I think there's some form of sort of a stigma associated with it. People are like, oh,
Stigma.
yeah, people are like, oh, cancer, that means she's going to die.
Yeah.
And then so people who actually have been diagnosed with cancer don't want to tell people. They don't tell people. They don't tell even their close relatives and all. They don't talk to people. And then at the end of the day, some of them actually die in silence because they don't tell people. They don't get support, no financial support, no social support. And then at the end of the day, not even the cancer itself, they die of probably depression. Exactly. So I think that people need to be more conscious of their environment. Cancer is not an infectious disease. Let's get that straight. It's not an infectious disease, so there's no reason to stigmatize this. I think, okay, now let me get to our foundation. St. Cyril Cancer Treatment Foundation actually focuses on cancer treatment in Nigeria. Our mission is to build several cancer treatment centers in Nigeria and across Africa.
So presently, where are you guys right now?
We have a functional clinic at Isolo, 40 Akimbai Street, opposite the Upper Palace, Isolo. There's a functional chemotherapy clinic there, yes. So we have oncologists come on appointments with our patients, and then we have infusion pumps, so it's actually easier and better to administer these chemotherapy drugs. And we're basically interested in providing quality care for cancer patients now.
Okay.
Yeah.
You've heard it here first. It's not infectious. It's something that if you find somebody that has cancer, all you need to do is show love, show care, and make sure that you show support for the person, because it's not an easy disease. It's very painful. It's very depressing. Well, continue to listen to Health Matters.